Okay, start now, please.
Okay. Hello, good morning.
Good morning.
I'm Dr. Said, one of the doctor today. Are you Mrs. Amira Patel, 35 years old?
Yes, doctor. You can call me Miss Patel.
Miss Patel, okay. Okay, thank you for letting me know. Miss Patel, today I'll be asking you a few questions and then I will examine you. Is this okay?
Okay, doctor.
And during our conversation, I will be making some notes and it will be confidential between us. Is this all right?
Okay, doctor.
So I was going through your GP letter and it states that you are having some problem with skin rash on the hands and face. Is this so?
Yes, doctor, you're right.
So can you show me and can you tell me more about it?
Oh, yes, doctor. The rash has now started almost 2.5 months before, and initially it was, small in number and small in size, and by day it is getting more and more. I was
Mm-hmm.
thinking it's because of sun exposure, but it's not
Mm-hmm.
the case. And nowadays, you can see my face and I can show my hands also.
Yes, please. Can you show
Oh,
me your hands?
yeah, yeah. Look,
Mm-hmm. Oh, I know it must be very distressing for you. Okay, so can you tell me more about it? It developed suddenly?
no, doctor, it's started gradually. Initially, it was small, it was 1 or 2 spots, but
Mm-hmm.
it's going day by day, more in numbers.
Mm-hmm. And now where, like, how it is spreading apart from face, where it is spread to?
My hands,
Okay, okay. Any itching on this rash or any like pain, any swelling,
no itching, no swelling, no pain,
no bleeding?
no bleeding.
No, okay. And how your skin behave to light?
It's no redness normally under sun exposure. It's not irritating me.
Okay, okay. So it's just bothering that your skin color is changing.
Yeah, doctor, no, it's just distressing for me. I'm missing my job nowadays because of social issues, and
Mm-hmm. That's fine. Okay, can you tell me like in any body part you have felt that the pigmentation is increasing or they are getting darker?
no, just like my face and my hands.
Okay, okay. Apart from that, any long-term illness you have which I should be aware of?
No, doctor.
No. Okay, so can you tell me more about this rash? Like, is this worsening from last 2.5 months, or is it the same, or is it improving?
No, doctor, it's increasing day by day. I told you that it was small in numbers and small in size, but
Mm.
it's getting more in numbers and increasing by size also.
Okay, okay. Any things which makes it better?
No, I didn't notice anything. I have tried a lot of creams, sunblocks,
Mm.
but
And okay. Any things which makes it more worse?
no, doctor, I didn't notice anything.
Okay, have you noticed that when you scratch and when you get any trauma, so this patch appears there as well?
No,
No, okay. Okay, and apart from that, okay, now I'll be asking you some series of questions so you can tell me yes or no. Any headaches with that?
no.
No. Any dizziness?
Yes, doctor, I feel dizzy, sometimes when I'm standing from
Mm-hmm.
sitting position. So
Mm-hmm.
I'm relating it my, hectic job
Okay,
sometimes,
then. Okay, so can you tell me how frequently you get this dizzy episode and since how long you are getting it?
I'm getting this episode for last 3 months, doctor.
Mm-hmm. And how frequent?
It's, almost every day.
Okay, and then are you taking any medication or any precautions for that?
No,
No. Okay. Any weakness or have you ever fainted?
I didn't faint it, but I feel fatigue myself, doctor.
Mm-hmm. Tired?
Yeah, tiredness.
Okay. Okay. Any weakness in any part of the body?
No, no weakness.
Okay. Any vision problem?
No vision problem.
Okay. Any hair loss?
No hair loss, doctor.
No. Okay. Any sores in your mouth or your private parts?
No,
Okay. Any neck swelling or any other swelling in any lumps and bumps in your body?
no, doctor, I didn't notice.
Okay. Any weight changes?
Yeah, doctor, yes, you're right. I'm getting
Mm-hmm.
weight now.
Are you gaining weight?
Yeah,
Okay. Since how long?
almost, 3 to 4 months.
Mm-hmm. And can you tell me how much kgs you have gained or stone you have gained in how much
It's
duration?
it's 3 to 4 kg in 4 months.
Mm-hmm. And like any recent eating habit changes, or you are eating more, or just you are getting this weight gain?
My eating habits are similar, doctor, as in the past.
Okay, okay. Any weather preferences?
Yeah, yes.
Mm-hmm.
I'm feeling
Mm-hmm.
more tired and more cold nowadays.
More tired. Okay, okay. That's fine. Okay, and any racing and pacing of your heart?
No,
No. Any shortness of breath?
no,
Any chest pain?
no,
Any tummy pain?
no,
Any problem with swallowing?
no,
Any nausea? Any vomiting?
no,
Any changes in your water works?
no.
Any changes in your bowel works?
Bowel works are, a bit, loose nowadays.
Mm-hmm. Since how long?
It's a 1 or 2 months, doctor, similar duration almost.
Is it diarrhea, or is it just change in the frequency or amount, or in what way you are saying that you are having this problem?
I can't say exactly, but it's more. I'm passing more than usual nowadays, and it's loose
Okay.
always.
Okay. Have you ever passed blood in your bowel works?
No,
No. Any increase in your water works?
no,
No. Okay. Any leg swelling?
no leg swelling.
No leg swelling. Okay. Uh, okay. Um, okay. Do you have you ever been admitted with any problem in the past in the hospital?
No, doctor.
No. Okay. Any surgeries previously done?
No,
No. Okay. Do you find difficulty in walking or going upstairs or combing
no,
hairs?
no.
No. Okay. And has someone told you that you are getting paler day by day?
Not someone. I feel myself that I feel, but I think it's not the case that I'm pale
Mhm.
than usual because of this color of my skin. Maybe.
Okay. 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 Do you have any allergies?
No,
Are you taking any medications?
no,
No. Okay. Any recent change in medication or any recent medications?
no.
No. Okay. Okay. What do you do for your living, Miss Patel?
I'm IT manager, in the one firm. I'm working there.
So, are you finding it difficult to cope up with the job?
Yeah, of course, doctor. So social issues, no issues, and everybody is commenting on your face and hands. It's making me so aggressive. So I have stopped going to attend my jobs. So I'm here to
Mhm.
seek help from you.
Yeah, I'm sorry, I can understand. I will try to sort this out for you, Miss Patel. So, can you tell me, do you smoke?
I do, yes, doctor.
Okay, and do you drink?
Yes, I
Okay,
drink socially.
okay, and do you drink in normal limits?
Yes, yes, social. I'm taking the social limits.
Okay, and how many cigarettes you are taking and since how long?
It's one pack per day for last 10 years.
So, Miss Patel, I will advise you to stop smoking because it's not good for your health. And if you need any help with quitting smoking, so we have smoking cessation clinics as well.
Thank you, doctor. I will think about that. Thank you so much.
Okay, any recent travels?
No, doctor, no travel.
And do you drive, Miss Patel?
Yes, doctor, I do drive.
Okay, so are you finding any difficulty in driving?
Not at the moment, but these disease spells sometimes making me worry about that. Maybe I will have some bad days.
Yeah,
Make
so
me.
so Miss Patel, I will advise you to stop driving at the moment as well until your condition's been diagnosed. Okay, can I ask you some personal questions now?
Yes, doctor, you can ask.
Okay, are you married, Miss Patel?
Yeah, doctor, I am married.
Okay, and do you have a stable partner?
Yes, I have a regular partner.
Okay, do you have kids?
I have two kids.
What's the age of your last born?
5 years.
Okay, any pregnancy loss?
No,
Are you taking any pills?
no,
Any chance of pregnancy at the moment?
no.
No. Can I examine you, Miss Patel?
Sure, doctor, you can examine me.
Yeah. So I'll be checking this white
Mhm.
patches,
Okay.
and like I will also want to check this patches on the whole body. But the patient told that she's not having. And then pulse. Is this bradycardia?
Pulse is normal, doctor.
Okay. Any anemia in the hands?
No,
Any darkening of the palmar creases?
no.
Okay. Any posture drop?
Blood pressure 110/70. There's no postal drop. You cannot identify.
Okay. Any postural tachycardia?
No,
No. Okay. Any vision problems?
no vision problem.
Okay. Any ulcers in the oral cavity or any pigmentation?
No ulcers.
Okay. Any goiter palpable?
No, you cannot see any
Okay.
palpable goiter.
No lymph nodes.
No lymph nodes.
Okay. What about heart?
What do you want to see in the heart? Two.
Any murm any
Sorry.
murmurs?
No
Any
murmurs.
murmurs? Okay.
No
Any
murmurs.
pedal edema?
No pedal edema.
Okay. Okay. Reflexes?
Reflexes are normal.
Normal. Okay. So do you have any concerns, Miss Patel?
Yes, doctor. I have a list of concerns. What's going on with me, doctor? Why I'm having this condition?
So, Miss Patel, based on your history and your examination, it looks like that you are having an autoimmune condition. It's called autoimmune polyendocrinopathy syndrome. Have you ever heard about it?
No, doctor.
So let me tell you that it's the like alteration in the defense system of the body, which instead of attacking the bugs, it start killing the your own cells of the body. Like in your case, it started destroying the skins in your cells in your skin, cells in the gland which sits on your kidney, and also it started affecting the gland in the neck as well. So that's why you are having these symptoms, like you are having this white patches, you are feeling more cold, you are gaining weight, you feeling dizzy as well. So, Ms. Patel, we need to investigate you further to reach to the diagnosis, and then I will be in better position to tell you what's exactly the problem is. Is this all right?
Yes, doctor, it's all right, but I know I will very interested to know that will this rash leave scars on my face, on my hands? You know,
Miss Patel, it won't be causing any scarring on your face, but I'm afraid that these patches will remain as it is, as they are now. But we will try to do give you some medication to apply as well to regain the pigment back. But I'm not sure that they will be helping much or not. But right now, I cannot say anything at the moment. I need to confirm by doing all the investigations, and then I will be able to tell you. Is this all right?
it's okay, doctor, but these rashes sign of something more sinister, serious illness in my body.
Miss Patel, as I mentioned previously, that you are having a group of symptoms and the disease I mentioned you. So it's a group of conditions. So it's quite a progressive condition, but we can control it with the medication. We will be telling you some precautions as well regarding your this dizziness which you are feeling, so that that your disease should be under control.
So, doctor, are you going to admit me?
Miss Patel,
Time up,
hello.
but you can continue. Yes, time up, but you can continue, doctor.
Yes, because you are feeling dizzy, so I will be admitting you. I will be doing a few tests, and then we are planning for the discharge with the long-term management plan.
Okay, doctor. Okay. Okay, doctor. Do you want to summarize now or you want to take some time?
And just 1 minute.
Okay. You have total 5 minutes. If you will take 1 minute, then you will have 4 minutes in your hands to answer the question of examiner. Okay.
Okay. Okay, I can summarize.
Okay. Summarize it.
So Miss Patel, 35 years old lady, presented with white patches starting from the hand and spread to the face from the last 2.5 months. Along with that, she was having some disease spells as well from last 3 months, and also she was having tiredness as well. She gained weight, 3 to 4 kg weight gain in last 4 months, and she is also having some weather preferences. She was feeling more cold and more tiredness. Apart from that, she is having some. She was complaining of change in the bowel habits as well. The rest of the history was unremarkable. Um, I forgot to
Okay.
ask the family history. Okay. On examination, she is having this white patches on the hands and on the face. Apart
Mhm.
from that, the rest of examination was unremarkable, but her blood pressure was 110/70, which was at the lower end. And she was anemic on examination as well.
Okay.
The rest of the examination was unremarkable.
Okay. So, what's your differential diagnosis in this case, doctor?
So one is autoimmune polyendocrinopathy syndrome type 2,
Mhm.
or it could be separately hypothyroid with autoimmune involving like this Addison's and vitiligo.
Mhm.
Um, mm,
Okay. What else?
yes, um, these two.
Okay. Any other conditions in your mind? Okay. How you're
Um,
going to investigate this case?
then pituitary tumor. Otherwise.
Okay. How you're going to investigate?
So I will investigate this patient by doing like routine blood test, full blood count to look for anemia, to look for any infection or any low blood count as well, like low platelets. Then CRP, ESR, electrolytes, mainly sodium, potassium, renal
Mhm.
function test, liver function test, and for
Mhm.
vitiligo, need to do the biopsy, skin biopsy for hypothyroid thyroid function test, and also anti-TPO antibodies. And
Mhm.
also for Addison's, need to check the 21 beta hydroxylase antibody, and also the test of the Addison's like short synectin test, and initially cortisol and then short synectin test, and long
Well,
synectin test as well.
okay.
Um, and what else? And then CT of the abdomen for adrenals.
Okay. CT or MRI have done. Okay.
Mm.
What else you can do for this patient? And how you're going to manage this case?
What else? So, and need to do the autoimmune screen as well, and to look for the antibodies of the pernicious anemia.
Okay.
Um,
Do you want to do any test for this, loose stools, the diarrhea?
Yes, stool RE, routine examination and stool cultures as well.
Okay, how
Because
you're going to manage?
celiac disease can be associated. Um, the management will be by patient education and counseling. It will be by the multidisciplinary team. We need to counsel the patient that she should stop smoking, she should stop taking alcohol, she should stop driving as well. And
Okay, time up,
um,
but you can continue. Okay,
Okay, then the multidisciplinary team involving the endocrinologist, gastroenterologist, the skin specialist, physiotherapist, occupational therapist, and then depending upon the underlying cause, we need to treat the underlying cause, like whatever we will find in the investigations.
okay, okay, doctor. Thank you, Dr. Roshan. Thank you very
Thank you.
much. Thank you. So tell me about your performance by yourself, then we will discuss your performance, how you feel.
So by reading scenario, I thought it will be like skin rash. So most likely it will be connective tissue disease. So I was thinking of the SLE and before
And,
sorry.
okay. No, that's a wonderful that you were thinking on that. But why you didn't ask any question about the SLE or
I
joint pains?
asked I asked joint pains. I asked oral ulcer. I asked hair loss, and I also asked about the how your skin behave to sunlight.
Okay, okay, okay.
Yeah.
Very nice. So,
Just I forgot to ask the
hmm,
Raynaud's.
okay.
Mm.
Okay, so this was a case very well done. Your performance was excellent. Your confidence and your flow was unmatchable. You started your case with your introduction. You set an agenda. You check the identity of this patient. Then you mentioned that I'm going to take few notes, and you did ask everything which is necessary in the introduction part. And you started your case very well, with starting with the rash and OD para, how it was, started and how it's behaving, like aggravating or relieving factors, and what are the local associated and general associated questions.
Mhm.
So physical examination, there are few things were missing. Otherwise, you can get full marks over here. Okay. Identifying physical signs, skill B was good. You did check the postural drop. I was expecting that you will check, and you did check about paler lymph. You were searching about the lymphadenopathy. And one more thing, if you are suspecting that someone is having Addison, and you are thinking about the tumor, if you are doing the CT or MRI, you just palpate the abdomen. Okay, otherwise it was fine.
Okay.
Clinical communication skill, there are few jargons over here, which should not be there actually. You use the word nausea and vomiting. This will affect on overall your scoring here.
Oh, okay. Yeah, I didn't realize that I used the
Yes,
term nausea.
yes. And you use the word of autoimmune, then you covered it up in the later explanation. That's why you are your time is not managed. You give a too much explanation to the surrogate
Mm,
in the first concern must be, you should address in a few lines, and it should be a brief, and just save your time over here, when
mm,
while answering the first concern, so that you
okay.
have four concern in front of you. You should address all these concerns. If
Mm,
you're thinking that you are going to address one concern and it will cover all the marks, no, you will get only one mark of this whole explanation, because a surrogate is having specific paper in her hand. So she is dedicated. She has been appointed to ask these questions. 3 4 questions are there always. So
mhm,
save your time over here. Okay. Coming to the
okay.
differential diagnosis, this is the area where a lot of candidates, like going to appear cases, are failed to put a differential diagnosis. What do you
Mm.
think? What differential diagnosis could be in this case? And what was the case? What was the presenting complaint?
Um,
What do you
uh,
think?
Presenting
So,
complaint was skin,
ra-
like what you like.
skin rash. I'm
Yeah.
right.
Hmm.
So your differential diagnosis must be the condition which can produce a similar rash. Am I right?
Okay, leprosy and okay,
Yeah. Very well done.
fungal
Very well done.
infection.
Yes, tinea
Yeah.
versicolor, sarcoidosis. Yes, skin manifestation of the sarcoidosis, leprosy.
Yeah,
Okay,
yeah.
vitiligo, tinea versicolor, psoriasis might be. You can put albinism in the long range if you want to put, but
Mm.
other three, four differential diagnosis very important to give you full mark if you put these differential diagnosis. You can say this can be a vitiligo, this can be a tinea versicolor, psoriasis or lichen planus, okay, or Hansen's disease. But in this case, I can see that it's a
Mm.
vitiligo most likely the top differential. Okay, with like on the background of some endocrine disorders. It might be a APS2, it might be a hypothyroidism, it might be Addison. So you can defend your case over here in this way.
Mm. Yeah,
this
true.
this is the only, yes, this is the only area which you are going to affect your oral scoring. Otherwise, you did very well all over the your case. Clinical judgment was good. uh, you were identifying impact. There are always three type of impact of any condition: on the job, on the
Mm.
social life, and on the drive. But you missed, I think, this social issues. Okay,
Yeah,
you did
I
ask
should
about the
admit.
drive. Yeah, you did ask about the drive, job. That's very well done. Smoking, and
Mm.
you did offer the patient to stop smoking, encouraging smoking cessation clinic to referral also. That's wonderful. Okay, so clinical judgment, you are going to admit this case and you are going to run some blood test. Overall, your score is not going to be affect more because you did very well on the previous year skill. So that will cover your others, judgments. So managing patient concern was good. She was
One thing
interested
I want to ask.
yeah.
Sorry, one thing I want to social. I mentioned the social services, but yeah, definitely I didn't touch the social services very well. And also, she was having this phobia that she cannot go to the place or cannot work. So I should have like counseled her about the camouflage, like makeup for now and to hide this. And yeah, I missed that. Yeah.
Yes.
Mm.
So whenever the patient is having some social issues, just do mention. I understand your, frustration. I
Mm.
understand your worries. It must be frustrating for you, but I'm here to help you and support you. Don't worry about that. We have a lot of options available for that also. So in this way, you can cover up this.
Yeah. So actually,
Nonetheless,
time was up as well. So I messed with the time at end.
why the time was the problem, we are going to discuss in a few seconds. Okay.
Okay.
Let me finish your scoring criteria first. And patient concern was good. Is it a serious condition? Yes, it might be a serious condition, but it's early to say. Okay,
Mm.
so I'm going to suffer for a long time. It's very early to say I'm going to suffer or not. We need to run some blood tests and scans of your body. Once scans will be available, I will be in better position to tell you about these your queries. Well, very well done. And patient's welfare was good. So overall, you did very well. The problem we are facing, like being a candidate, is a differential diagnosis always in long
Mm.
clinical consultation. The second important part is physical examination and identifying physical signs. I say really, can say to thanks to you, you did not cooked any physical sign. Okay, everybody knows that if you are not identifying physical sign, you are going to lose only 1 mark. If you are making physical sign from your side, you are going to lose 3 marks. So
Mm.
if you are not sure, don't try to be over smart and don't mention the things which are not there. If you are double minded, it means this is not a physical sign, so they are not calculating it as a physical sign. It's written in their criteria book. If there is some doubtful, so we are not keeping those physical finding in a marking criteria. So if you feel anything is doubtful, please be silent, don't mention it.
Okay.
Okay, Dr. Afia, overall, your scoring score is going to be more than 25. Few things, differential diagnosis and jargons. As you
Yeah.
are going to appear, near future, so try to avoid these jargons. Time
Mm.
management is an issue, big issue, and this will make you crazy in exams if you are short of time and you have a lot of skills ahead to fulfill these skills.
Mm.
Taking a history only giving you only four marks. You did very well. You screened the questions in a short way. You didn't go in the depth. That is the requirement of this clinical consultation according to the time. But a few things you started to dig into the details that make you in trouble for you to manage the time. Try to finish your Odipara and all these questions, okay, within a 7 minutes, so that you will have a 5 minutes at least for examination. If you are sitting there, online examination is very easy to say, I will do
Yeah.
this, I will do this,
Yeah.
okay, but on the bedside it's very difficult to manage the time.
Yeah.
And one
I
and
agree.
more, yes, sorry. One more thing, you were telling me about the, I want to see the, other body parts to see the look for the rash. Very well done. But in real exam, do mention to the examiner, sir, I want to expose the patient. And
Yeah.
he will ask you why you want to expose. So if you will mention that I want to see the rash, if there will be any rash, then he will give a clue that there is a rash on the back or the thighs or the legs. So you can get an extra mark for that. Take permission from examiner.
Okay.
Okay, otherwise I have nothing to add a lot in this case, because you were trying to do everything possible. So how can we approach vitiligo? This is a short survey to approach in a given time. And don't spend too much time, doctors, please. My humble request to all of you: when you're taking the history, it's a, of course, it's a very lengthy history. You cannot fulfill all the criteria, but it's a requirement of RCP. Please be a focused history and focus examination. Everywhere they are mentioning focused history and focus examination. Doctor did very well. She picked up few things and she was taking these as a leading symptom, and just she was digging out what is the reason behind. It's a good approach, very good approach. So this must be approach, but there are few things again. So don't spend too much time on this part, because this part will give you only 4 marks. Once you will finish, you are going to just mention on the 7 minute, I want to examine. If you will examine, you will get 4 extra marks, 4 to 4 8. And if you find any physical finding, then again 4 marks. So physical examination when you're doing, so this all, if you collect, these are the 8 marks. Okay, then
Mm.
patient's concern, 4 marks. So on the real patient you have 12 marks when you're going to stand and just asking for the permission. And after, now see how many marks are within 5 minutes and how many marks you have spent in the 10 minutes. You take the history in 10 minutes. So total 4 marks. Now going for examination and physical finding identification, 8 marks total. Then put in differential diagnosis reasonable, again 4 marks. Then management plan and investigation, again 4 marks. Patient welfare and
Mm.
clinical judgment. Clinical judgment, it's include your plan of investigation, plan of management, and patient safety, are going to admit or not. These are the clinical judgments. Coming to the slide, whenever we have a vitiligo, okay, possible presentations with maybe anemia, fatigue, diarrhea, and jaundice. Okay, anemia for celiac, fatigue for hypothyroid, and diarrhea for celiac. Okay, show me your rash. This must be the first question in your history taking. Then check the size, shape. There are itching or painful, palpable, blanchable. Then coming to the OD para, onset, duration, progression. Okay, aggravating factors, living factor, and association. Aggravating factors can be a SAD. You can use a mnemonic of SAD: sun, smoking, stress, alcohol, and drugs. And the top differential, you can just remember only the one word, that is red, RE, red. RED, rheumatological causes, endocrine causes, and digestive system. These are the most common occurring systems in PACES exam. So your question must be oriented around three systems. Take a short history of diarrhea, constipation, jaundice, and itching. Finish. You have done with the digestive system. Endocrine is a hypothyroid, most likely. If not hypo, then Addison. Okay. Then rheumatological questions, two, three questions, not more, just for screening. Joint pain, rash, tightening of the skin, proximal myopathy, mouth ulcer, alopecia. Okay, this will help you to screen the system only. After finishing these questions, come to the wafers. Wafers, I used to, this mnemonic for the general symptoms. W for wafers. Sorry, weight changes. Any weight change. Don't use the word weight gain or weight loss. Weight change. It can cover the both. Anorexia, fever, and second F for fatigue. Then itching, rash, racing in the heart. What about your sleep? Do you snore at night? Do you sweat more than usual? And immediately after finishing the questions of journal, just ask about the impact on job and life and drive. The third circle is missing over here. Do ask about three impacts immediately. This will give you extra marks, clinical judgment, and patient welfare. So you must be very, sharp in grabbing the numbers rather than to impress the examiner. So I'm very good in history taking. No, you collect your numbers. So patient welfare, you will get the marks if you're going to offer some social sports and occupational supports, or you are thinking about the drivings. Clinical examination, starting from the hands. You Palmer creases, she did very well. Prick marks for the diabetes and tremors, sweating, pulse. Okay, tachy or bradycardia, BP, and postal drop. You must offer the postal drop, doctor. Next time, if you are going to exam very soon. My advice: just when you're checking the blood pressure, just do mention, I would like to check the blood pressure and postal drop. Do mention the examiner. You don't have a
Mm.
time to check the postal drop. Why? Because its postal drop will take 1.5 minutes or 2 minutes, minimum two
Yeah.
minutes, even more. Check proximal myopathy in any case of vitiligo, and the thyroid asked to swallow, mouth for pigmentation and ulcers, face for rash, eye dry redness and pallor and jaundice, scalp for the alopecia, abdomen, liver and spleen, legs for erythema nodosum, pretable myxedema. After finishing things, just ask about the concerns. So in this way, you can handle the vitiligo in exam if you will face this type of cases in exams. So be careful, doctor, in putting your differential diagnosis. If you give me the 100 this differential diagnosis, some few conditions of the skin, I will give you 28 marks. I will overlook your jargons also. I can overlook. But differential diagnosis, this is separate skill. You need to be very vigilant while putting the differential diagnosis.
Mm.
I hope we have learned a few things today. What do you think,
Yes.
Dr.?
Yeah, definitely.
So, thank you so much, Doctor, for today's case. I hope
Thank you.
this will help you.
Yeah, it
Is
was
there any
quite.
question so far? Yeah. You have any question, Doctor?
Um, no, because I was just liking, I think when you were mentioning that I have like explained autoimmune, and it take a lot of time. Actually, it took all the time.
What you can, I can tell you, just whenever you have a case of any kind of case, I'm not. Just a minute, I will mute all of you. Okay, doctor. So it's my humble advice, all of you, when you have any condition, just mention a few lines and you will be in safe zone. Based on your history and examination, I have couple of things, a few things in my mind. Okay. So I'm going to run some blood tests and scans of your body. Once the result will be available, we will be sit together and make a management plan with you. Most likely you have a condition, it's a which is uh, you know uh, which is attacking your defense system. Okay. and most likely you will be treated by a gland doctor and means gland doctor and a digestive doctor or the bowel doctor. Okay, few lines, no need to, because you have four concern, 4 marks.
Mm.
To fulfill the criteria, we are there to look, doctor. The name of PACES exam, I used to stress on this always. Practical assessment, clinical examination skills. They are, observing your skills. Just jump from one skill to another skill. If you are missing something in the history, but you picked up the diagnosis, jump to the other skill. Go for the examination. Do an examination in a sharp way. Make your good scheme. Start always with the hands. In any case, whatever the case is there, start from the hands. Picked a few possible, differential diagnosis. I'm very happy from your performance that you picked up these rashes, and you have mentioned. Many candidates forget to mention these rashes to the examiner. Why? Because they are thinking, once our eye can see, so examiner eyes are also watching at the these rashes. So why I should need to put an other, these physical findings. You did very well. So you mentioned that there is a rashes, there are spots on the hand on the and on the face. So wonderful. Then next concern. Will I get better? I highly appreciate your concern, Mrs. Patel. It's very early to say, but in this condition, this is not curable. But the symptom will be controlled. You have done very well. Doctor, do you think something very serious is going on in your body? I highly appreciate your concern, Mrs. Patel. Yes, your concern is quite well, but it's very early to say. The condition which I'm mentioning here, it might be serious, but it can be controlled. Okay. Again, simple one-line answer in concerns. Don't overlook the concern, but one-line concern is enough. Why? Because you have only 2 minutes with the
Mm.
surrogate and 4 concerns. 30 seconds for each concern. Am I right?
Yeah.
Then when you finish, you have 5 minutes with the examiner, and he is having 5 skills in hands. Differential diagnosis. Okay. Are you going to patient safety, patient welfare is also there. Then how you're going to investigate, again your marks, how you're going to manage this patient. So at least 4 skills, not five, 4 skills is having in examiner's hand in 5 minutes. Be quick. Don't give a too much explanation to the examiner also. Sir, I would like
Mm.
to run some blood test. Okay. Baseline investigation and specific investigation. Baseline investigation, CBC, ESR, CRP, LFTs, RFTs, serum electrolytes, urine complete examination. Okay. The specific investigation, it will be include thyroid profile, thyroid function test. Okay. Serum ACTH and cortisol level to look for the adhesion. In accordingly, specifically, don't give explanation to the examiner over here while you're answering to the. If examiner will need something, he will ask from you by himself. Okay. You should continue your continue your scheme. How you're going to manage this case? Non-pharmacological, pharmacological. Non-pharmacological treatment is almost always similar in PACES exams, especially long clinical consultation. Patient education, patient counseling, lifestyle modifications, social, psychological support. 4 points for all.
Mm.
If you put these 4 steps, this will give you a boost. They will give you a confidence that you're so confident that you know how to manage this case. Then, of course, multidisciplinary team. Don't put multidisciplinary team at the top. For these points in the beginning, then accordingly, multidisciplinary team, gland doctor, heart doctor, GIT doctor, then the specific according to the cause. Finish.
Mm.
You have done your job. Just you don't have a time to read these big books, in, especially for the paces. You know how long you are practicing. How many books you can follow when you are going to put your trade management plan? How many? Is there any specific, are they asking a specific new advancement? No, they don't have a time. You don't have a time to mention that.
Mm.
Overall, your performance was good. The things which were missing, I think you came to know. I hope
Yeah.
this will not, you will not repeat. Time management is the key
Yeah.
in long clinical consultation. Okay, thank you so much, doctor, for
Thank you.
your